Hello, hi and namaskara. My name is Kirtan and I am a second year medical student studying in a government medical college. Today I will be talking about the topic factors affecting the cardiac output. This is the part 2 of the cardiac output video. In the previous video, that is cardiac output part 1, I discussed about the factors regulating the cardiac output and also about some important terms like cardiac output, cardiac reserve, stroke volume, and also how the methods to measure the cardiac output. So in this video we will be talking about the factors affecting cardiac output. So you may think, what is the difference between factors regulating the cardiac output and factors affecting the cardiac output? So factors regulating the cardiac output, those are the factors which maintain or regulate the cardiac output. So the factors affecting the cardiac output, these are the factors that when there is a change in this factor, the cardiac output can change. So the factors regulating the cardiac output maintain the cardiac output. So in the factors affecting the cardiac output, there is two points, that is factor affecting stroke volume and factors affecting heart rate, because stroke volume and heart rate multiply give cardiac output. So in the factors affecting the stroke volume, there is preload, inotropic state, that is the myocardial contractility of the heart, and the afterload. So preload is nothing but the end diastolic volume and the afterload is nothing but the peripheral resistance to the heart. So under the preload also there are factors which regulate this, that is venous return, arterial pump activity and ventricular compliance. In the inotropic states, it's ventricular muscle mass, autonomic activity, hormonal and chemical factors, drugs. In the afterload, these are vessel diameter and the viscosity of blood. But in the factors affecting the heart rate, there is only one thing, that is autonomic activity. So we will discuss about these steps one by one. We will discuss about this point one by one. So the first one is the venous return. So in the venous return, it is the amount of blood that returns to the right atrium from the systemic venous circulation. So venous return comes under the preload. So in the venous return also, under this also there are many other factors which affect the venous return. So the first one which affects the venous return is the skeletal muscle pump. So you may know that in a muscle, so you think this as a muscle, and this is the blood vessel which is between the muscle. So when the muscle contracts, the blood vessel also contracts and the blood goes upwards, that is in the legs. So in the legs, when the muscle contracts, the blood goes upwards. It does not go backwards because there is a valve, distal wall. This is called the distal wall, which is present in the distal side of the blood vessel, which is present in the muscles. So when the muscle contracts, the blood moves upwards. So the venous return increases. So therefore skeletal muscle pump helps in the venous return and increases it. So there is also a clinical significance here. So traffic police, mainly they are affected by hypoxia, because when they stand for long hours, the blood will pool in the muscles containing these blood vessels. So in these blood vessels, the blood gets pooled because there is no contraction of the muscles, because it is standing still. So when there is no contraction of the muscles, there will be no upward movement of the blood. So there will be less cardiac output, and therefore the blood will not supply oxygen adequately for the tissues, which causes hypoxia and fainting. So this is one clinical significance of the skeletal muscle pump mechanism. So the next pump is the thoracic pump. So during the inspiration, the cardiac output increases. Increased cardiac output. This happens due to the negative intrathoracic pressure. So the negative intrathoracic pressure will become more negative, and therefore there will be increase in the cardiac output. The next is the abdominal pump. So this is same. So when there is inspiration, the abdominal muscles also help in the inspiration. So when these contract, there will be again increase in the cardiac output. The next one is the Ecf volume. So when there is decrease in the Ecf volume, that is nothing but the extracellular fluid, there will be decrease in the cardiac output. So this happens during diarrhea, sweating and many such cases. So the next one affecting the venous return is the sympathetic activity. So as you know that the sympathetic control affects the venous by venoconstriction. So in parasympathetic control, it affects it by venodilatation. So when there is venoconstriction, that is due to the sympathetic activity, there will be increased cardiac output. So the right atrial pressure also affects the venous return. When the right atrial pressure is more, the venous return will decrease. So therefore the cardiac output will also decrease. And the resistance to the venous return. This also acts the same way. This also prevents the venous return to increase, therefore decreasing the cardiac output. So this is the venous return part of the preload. The next factor affecting the preload is the atrial pump activity. You know that the atrial contraction helps in 20% of the ventricular filling. Though this is not much significant, it is mostly significant in the cases like exercising heavily. So in that the diastolic duration decreases, so therefore the atrial contraction is the main mechanism for pumping more blood. So therefore the atrial constriction helps in cases of heavy exercises. So the next factor is the ventricular compliance. Compliance means nothing but the stretchability of the muscle. So the stretchability of the ventricular muscle determines the end diastolic volume or the preload. So when there is more compliance, there will be increased preload. So because the muscle can stretch more, so therefore there will be more increased preload or end diastolic volume. So in the cases like cardiac myopathies, the compliance decreases, therefore the preload decreases, which again decreases the cardiac output by decreasing the stroke volume. So next we'll talk about the next factor, that is myocardial factor, that is inotropic state. In the myotropic contractility of the heart, there is ventricular muscle mass, autonomic activity, hormonal and chemical factors, and drugs. So these are the factors which control the inotropic state. So the ventricular muscle mass. So when there is increased ventricular muscle mass, there will be increased contractility. So this is obvious because when there is more muscle mass, there will be again more contractility. In the cases of atrophy means the decrease in the ventricular muscle mass. So in the cases of atrophy, there will be less contractility and therefore less cardiac output. So in the athletes, the ventricular mass increases. So therefore their cardiac output will be more due to the increased contractility or the inotropic state of the heart. The next factor affecting the myocardial contractility is the autonomic activity. The sympathetic stimulation increases the contraction of the heart. So therefore it controls the myocardial contractility. The next factor is the hormonal and the chemical factors. In the previous video, I have talked that hormones like catecholamines, insulin, growth hormone increases the cardiac output because they are positively inotropic. So they are positively inotropic and therefore increases the cardiac output. And there is also another hormone, that is acetylcholine. This is the hormone which decreases the myocardial contractility by breaking the intracellular cyclic AMP. So therefore the decrease in the intracellular cyclic AMP decreases the muscular contractility of the heart. So therefore acetylcholine decreases the cardiac output by decreasing the myocardial contractility. Now talking about the chemical factors, there are chemical factors like xanthines. So example of xanthines are caffeine and theophylline. So these are present in the coffee and tea. So this caffeine and theophylline, that is nothing but the example of the xanthines, increases the myocardial contractility. So whereas other chemical factors like hypoxia, acidosis is nothing but the decrease in the pH in the body, this is increased myocardial activity, this is decreased myocardial activity or contractility. So caffeine and theophylline increases the myocardial contractility and hypoxia and acidosis decreases the myocardial contractility. So other factor which affects the myocardial contractility is the drugs. Under that, the famous drug is digitalis, which increases the myocardial contractility. So it acts by decreasing the Na plus K plus ATPase activity. So due to the decrease of the Na plus K plus ATPase activity, the sodium will increase in the myocardial cell. So due to the more accumulation of the sodium in the myocardial cell, the calcium Na plus exchanger cannot work. So the work of the calcium Na plus exchanger is to pump out the calcium and increase the sodium concentration in the myocardial cell. But here the sodium is increased already in the myocardial cell, so therefore there will be no gradient for the sodium to go inside the myocardial cell. So therefore the calcium also cannot come out. So therefore the calcium will increase in the myocardial cell due to the increase in the sodium in the myocardial cell, which is already present due to the decreased activity of the Na plus K plus ATPase. So digitalis increases the myocardial contractility. So the next factor is the afterload. The factors affecting the afterload are vessel diameter and the viscosity of the blood. So the vessel diameter. So whenever there is venoconstriction, the vessel diameter decreases and therefore there will be increase in the cardiac output. Whereas in the venodilation, the vessel diameter increases and therefore the cardiac output decreases. In the viscosity of the blood, whenever there is increased viscosity of the blood, that is seen in the cases of polycythemia. Viscosity of blood. In the case of polycythemia is nothing but the increasing the RBCs in the blood. So when there is increased viscosity of the blood, there will be decrease in the cardiac output due to the resistance in the blood vessels. So this is all about the factors which affects the stroke volume. So the factors affecting the heart rate, as I told you, there is only one factor which affects the heart rate, that is the autonomic activity. Autonomic activity. So sympathetic stimulation increases the cardiac output by increasing the heart rate and increases the cardiac output, whereas the parasympathetic stimulation decreases the heart rate and therefore decreases the cardiac output. So in this video we talked about the factors affecting the cardiac output, that is the factors affecting stroke volume and the factors affecting heart rate. Under the stroke volume factors we discussed preload, inotropic state and the afterload, and also the factors affecting the preload, inotropic state and the afterload, that is venous return, arterial pump activity, ventricular compliance in the preload, ventricular muscle mass, autonomic activity, hormonal and chemical factors, drugs in the inotropic state, and the vessel diameter and the viscosity of blood in the afterload. So you can write this flowchart in a board examination if this question is asked in the exam, and also define these all topics under this flowchart. So that's it for today guys. If you found this video informative, please like, share to your friends, and also don't forget to subscribe for more physiology videos like this. I will provide the link for this video in the description below. Thank you.